the sake of attendance, we have Councilmember Evans, Gamble, Johnston, Nash, Porterfield, Roberts, Swope, and Taylor. Our new chair, I want to congratulate our new chair, Councilman Syracuse. Unfortunately, he could not be here today, and I'll be serving as the vice chair, so I'll be chairing today in his absence. Before we get started or go a little bit further, I also want to commend and thank our previous chair for all of her hard work. She did such an amazing job, so we can kudos to Councilwoman Evans for everything that she did. And with that, we'll go ahead and get started. Resolutions, RS 2022-1741, Roten, Gamble, Syracuse, and others, approves an epidemiology and laboratory capacity for infectious diseases grant from the Tennessee Department of Health to the Metro Board of Health to support all construction requirements associated with the cooler expansion project for the Office of Medical Examiner. Can we get a motion?
Seconded.
Thank you. It has been moved and properly seconded. Could we get an explanation of this?
They need more cooler space, and the state's going to help us pay for it.
What's the cooler space for?
Bodies.
Oh.
It's the medical
For
examiner.
the morgue.
Huh. All right.
Can't just put them in an igloo.
So I read something online that talked about more cooler space being needed across the country due to an influx of deaths related to fentanyl. Yes. So is this tied into that, or is this just in general?
I think it's just a sort of general growth in the need. People are dying from all sorts of things, and Nashville's getting bigger, and that's one of the biggest, and maybe the biggest medical examiner's office in the state. They get folks from other places, and so it's just growing.
Thank you so much. Councilmember Gamble, you are one of the lead sponsors. Would you like to speak to this at all?
No, move for approval.
All right, thank you so very much. It has, am I out of order? No. Oh, okay. It has been moved and properly seconded. Is there any additional discussion? No? All right. All those in favor say aye.
Aye.
Any opposed? Anyone not voting? All right, so we have 8 in favor, 0 against. RS 2022-1742 approves an American Rescue Plan funded grant from the U.S. Environmental Protection Agency to the Metro Board of Health to advance enhanced monitoring of particulate matter or other pollutants by improving Nashville's air monitoring network.
So moved.
Second.
Thank you. It's been moved and properly seconded, and this is brought by Roten, Gamble, Syracuse, and others. Councilmember Gamble, as a sponsor, would you like to speak to this?
I'd like the administration to speak to it.
$50,000 grant towards equipment for monitoring of particulate matter in ambient air. I think we've gotten this grant fairly routinely over the past several years.
Yep.
And the only difference I would add is that this is ARP money, but it's not ARP money that came to Metro as ARP money. It was given to EPA for this purpose, and they related on to us.
Thank you.
Thank you for the explanation. Any additional discussion? All those in favor say aye.
Aye.
Any opposed? Any not voting? 8 in favor, 0 against. Resolution RS 2022-1743, Roten, Gamble, Syracuse, and others, approves Amendment 5 to a grant from the U.S. Environmental Protection Agency to the Metro Board of Health for the ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee.
So moved.
Second.
It's been moved and properly seconded. Councilmember Gamble,
Defer to the administration.
administration.
Just an increase in the grant. This is an existing allocation we received, and this would increase it by about $300,000. So it's going to go from roughly $900,000 to 1.3. Same objectives of more particular monitoring of the particulate matter in our ambient air.
Thank you.
400,000 increase, not 3.
3 and change.
Well, 9 to 1.2.
But it's 9 point. Don't
2
make me
plus
do
2
math.
still equals 4. I'm telling you.
All right, is there any additional discussion?
Jesus.
Any questions? Nope. All in favor say aye.
Aye.
Any opposed? Anyone not voting? 8 in favor, 0 against. RS 2022-1744, Roten, Gamble, Syracuse, and others, approves a grant contract between the Metro Board of Health and Mental Health Cooperative to provide expertise and staff in emergency behavioral health care to support the launch and pilot year of the Metro Nashville Police Department's co-response model, Nashville Partners in Care.
Move to defer 1 meeting.
Second.
Second.
It has been moved and properly seconded. Is there any discussion on this?
Yes.
Yes,
The reason
I'm
for
sorry,
the referral?
actually, can I get Gamble first as a sponsor and then Councilmember Nash?
Yes, thank you, Chair, or Vice Chair. There were several questions that were brought up in the Budget Committee meeting about how the staff is trained and making sure that this is a continuum of the pilot that was started a year or so ago, and also wanting to make sure that Metro General Hospital is considered as is involved in this particular pilot. So for that reason, it was deferred in budget for 2 meetings?
just one.
One meeting. So we'd like to defer here as well.
Thank you, Councilmember Gamble. Councilmember Nash, would you like this to be recognized?
I hear the reason. Thank you.
Absolutely. Is there any further discussion? Commander, would you like to be recognized? Discussion on the deferral? No? All right. All in favor, say aye.
Yep.
Any opposed? Any not voting? 8 in favor, 0 against. RS 2022-1745, Roten, Gamble, and Syracuse, and others. Approves a grant contract between the Metro Board of Health and Mental Health Co-op to provide funds to operate a 24/7 mental health co-op treatment center to provide urgent medical health care alternatives to the emergency room or jail.
Move for 1 meeting deferral based exactly the same as 1741.
And can we just put 1746 on top of that, because it was also deferred
Yep.
one meeting for the same reasons?
Can I take those together?
Yeah.
All right, so we'll take together RS 2022-1745 and RS 2022-1746, Roten, Gamble, Syracuse, and others. Approves a contract for services between the Metro Board of Health and Neighborhood Health, Inc. to provide homeless individuals with medical and dental services at 2 or more clinics in or near downtown Nashville. So the motion on the floor is to defer for 1 meeting for both 1745 and 1746. Can I get a second?
Second.
It's been moved and properly seconded. Councilmember Gamble, would you like to speak to it at all?
Nope.
Okay. Any, yes, sir.
Could I just ask that 46 is very different from 45. What was the issue with 46?
The same questions about Metro General Hospital being involved and other questions, so it was deferred just like the other 2.
Councilmember Gamble, could you get with Mr. Sharp to make sure that the health department has those questions, or anyone, Hannah, I don't know if that would be you, but can someone get with Mr. Sharp to make sure that the health department has those questions so that they could be answered prior to the next meeting?
Sure. That's required, charter requirement. Yeah.
Awesome.
Oh, 46 is?
But we don't have to do it like I said.
All right. Any other discussion on the deferral? All right, all those in favor say aye.
Aye.
Any opposed? Anyone not voting? 8 in favor, 0 against, 0 not voting for both 1745 and 1746. Last item on the agenda, RS 2022-1753, Roten, Syracuse, and Porterfield. Approves an application for the Edward Byrne Memorial Justice Assistance Grant from the U.S. Department of Justice to the Metro Nashville Police Department for specialized training and equipment to ensure personnel maintains needed certifications for criminal investigation and crime reduction initiatives.
So moved.
Second.
It has been moved and properly seconded. So I guess I'm signed on as a sponsor here since our chair is out. I will defer to Commander Gilder. Could you speak to this?
Sure. So this is the JAG grant application. It's the one that comes up every single year. It's the Department of Justice grant. It's a little over $500,000, and we use it for necessary training and equipment. Training can include things from accreditation training, ICP training, Crimes Against Women conference, digital forensics training, and then also equipment purchases, things like the computer equipment that we utilize to do digital forensics work, ICAC, Internet Crimes Against Children. It's a whole list of things, but those are the big ticket items on that grant that we use that for.
Thank you so much. Does anyone else have any questions or any additional discussion? All right, all in favor say aye. Aye. Any opposed? Any not voting? 8 in favor, 0 against. And with that, our meeting is adjourned.
Nicely done.